Dr. Jessica. We're here doing a Facebook Live, and today we are going to talk about shoulders and things that I see in the office and how to do stuff at home, but then also what I do here in the office. So, if at any point during this Facebook Live, if you have questions about shoulders or things that you're experiencing, feel free to ask away, ask below. First and foremost, share if you're watching this, whether you are right or left-handed, because that will make a difference. And I myself am a lefty. I'm one of the few people in my family that's lefties out there, so essentially just waiting for it to come through on my computer so I can see the answers as we get going here, and comments, and if you have any questions. All right, well, today we're going to talk about shoulders. So shoulders are kind of complicated, and people always wonder if I can even help with shoulders because they disassociate their shoulders from their spine. And I do adjust extremities. So we have 4 different joints that I can adjust in the shoulder, and sometimes they need adjusting, but then sometimes your spine needs adjusting. And it's all dependent on what shows up when I have you on the table. So first we're going to talk about the 4 joints itself. So we have the glenohumeral joint, also this arm here, and the joint itself. So I check for motion in all different directions, whether it's internal rotation, external rotation, and see if we need any support there. And then we also have the AC joint. So a lot of times if people have had an injury, whether they were snowboarding or skiing or doing some extreme sports, you can actually separate that joint and you might have a bump on that area itself. So again, I'm looking for motion as your arm's lifting and then also as it's moving this way. So I can check those areas for that joint itself. Then we have the clavicle, which is also, what do other people call it? It escapes me, but people call it a different term. So I'll check that joint because you do have some motion there along your sternum and clavicle. So the sternum is the breastplate here, and then I check for motion there. Sometimes that can really mess with the functions of the shoulder itself. And then last but not least, we have the scapula or the shoulder blade, and that can move in a multi-direction. So as I'm adjusting and feeling for that, you may feel all of that when I'm assessing. So the shoulder is actually a floating joint. So it's not directly connected in most of the areas, but it's actually attached to your body through muscles. So having an imbalance in the muscles can really create a lot of issues. Now, this is when we can talk about spine, where sometimes it can actually be an issue in your neck or in your upper back. And what I mean by that is those muscles have direct communication with your brain, telling them when to get tight, when to get loose. And if that communication is a little fuzzy, that's when we can have issues. So we have a nerve supply that comes directly from our neck. All the nerves stem from the spine. So we can think about radiating issues, whether it's numbness or tingling. Sometimes people might have shooting pains itself. And we can get some clues to where that's coming from based on where your symptoms are. So these 2 fingers right here are actually C6, which is the base of your spine on your neck. Then we have this middle finger is C7. So that's the complete bottom of your neck, which is right at the junction there of your upper back. And last but not least, these two fingers stem from your upper back, also known as T1. So that's the beginning of your upper back itself. So again, if you're feeling radiation into any of these fingers, sometimes the neck is actually the issue. And I've been hearing a lot of that because we've been working from home, right? We have a completely different desk setup, stuff that we are not used to, and so that new position creates a lot of tension. And posturally, our body's trying to adapt to it. So that's how I know whether to adjust the spine, whether to adjust the 4 joints themselves. I do an assessment in the office to see that. So if you know anybody suffering with numbness or tingling, adjustments can really go a long way and make your life a lot better. Last but not least, I want to share what happens with parents. So with kiddos running around, they're all the time at home now, they're no longer in school. Your instinct to control them is just to pick them up, right? So this is where we can start to think about dominant hands. So we usually carry our kiddo in the hand that is not dominant. So I'm a lefty, and I would initially carry a kiddo on my right side because we want our dominant hand to have access to everything that we need to do, cleaning up the kitchen, maybe getting dinner ready, right? So then we have a lot of muscle tension on the upper right side. And that's the thing, people get confused. They're like, I'm dominant in my right hand, but a lot of the issues are on my left hand. And to them, it doesn't make sense. But for me as a practitioner, that is why, is because you're holding that weight on that one side. So my tip today for that is just to switch up your postures. Plus, if you're changing the activities that you're doing, whether it's brushing with your right hand, brushing with your left hand, holding the kiddo on the right side, holding the kiddo on the left side, it's actually good for your brain, and you're creating more neurons, and you're just going to be overall well-rounded posturally, but then also from a neural perspective. Well, that completes my shoulder synopsis today, and feel free to pop any questions that you have below. I will do my best at answering them, and then also if you have any issues yourself going on, adjustments can really help make your life easier and more comfortable and go a long way. Thanks for joining. I hope you have a wonderful rest of your day.